project at Missouri State University involves the implementation of a change project that affects healthcare outcomes, specifically to reduce health disparities among vulnerable populations. The focus is on a population or a systems level change. The student is mentored throughout the project by preceptor and DNP faculty. A systems level change involves a translation of evidence into the practice setting to improve healthcare outcomes. Systems level change is complex, and it evaluates the impact of various elements in a system, such as the organization, the providers, the patients and their family, and other stakeholders within the system that might affect healthcare quality. And in a perfect world, a change project should guide healthcare decisions and policymaking. To give you a really good example of some DNP projects, I'd like to introduce two former graduates, Dr. Melissa Penkowski and Dr. Kim Perryman. Both of these students had projects that made a terrific impact on the healthcare outcomes and health policy in the work settings.
I chose my DNP project at the healthcare setting that I worked in and looking at asthma. And I have a great passion for asthma. I personally have asthma and I have a daughter with asthma. And I've done a lot of education and programs with asthma in the school system. So my interest was surrounded pediatric asthma. And so I wanted to look at something that I could make an impact at my current health system. My DNP project was looking at provider adherence to evidence-based guidelines. Evidence-based asthma guidelines were developed and integrated into the electronic medical record system. Training was given to the medical providers and the staff, and a pre and post questionnaire was given to the medical providers to assess their attitudes and beliefs towards evidence-based guidelines, as well as pre and post data was collected with specific data points.
I am currently employed at Cox Health and I have a dual role. I am a primary care rural health nurse practitioner, and then I also serve as the nurse practitioner manager at the local convenient care clinics, and there are 7 of them in the area. I chose my project to focus on the convenient care clinics in part because antibiotic prescribing was a very common, challenging struggle for the nurse practitioners that I work with. And I wanted to meet that challenge by understanding and utilizing the DNP process to problem solve that clinical question. In the literature, I came to understand that it's a dual full process, that part of the problem or part of the challenge is meeting the needs of the patient while also meeting the needs of the nurse practitioners, who oftentimes recognize that they did not have the skills to have difficult conversations and lacked some evidence-based guideline understanding. So the process focused on providing education for nurse practitioners, communication strategies, training for nurse practitioners, and then also resources to help patients and patient education. All of the nurse practitioners continue to receive ongoing education on antibiotic prescribing and evidence-based guidelines. All of the new hires receive ongoing and more intense education. All of the changes that we made in the clinic setting, the handouts, the posters, the signage, all of those remain in place. We continue to monitor our antibiotic prescribing rates, and we also just completed a 15-month follow-up patient satisfaction survey, which showed that our prescribing rates have remained low and our patient satisfaction has remained exceptionally high.
There was a statistically significant change in the medical providers' attitudes and beliefs towards evidence-based guidelines. So I believe this project had made a great impact to improve asthma care, reduce hospitalizations, and increase the quality of life for patients with asthma.
It was twofold. One is that I learned and gained a much greater understanding of the impact of antibiotic resistance to our patients now and in the future. And then I also did accomplish the goal of learning how to problem solve using translational research and evidence-based guidelines. And I use that process every day in my practice.
When choosing a DNP project, I would suggest that you choose an area that you are interested in and an area that you can do the greatest benefit toward the organization. I would also encourage them to have a large sample size and this would increase the significance of the data.
My advice to the DNP students would be that they choose something that they are passionate about, that they will be heavily involved in this for quite a while, and they should choose something that really appeals to them and they can be passionate about.